Very much, Mr. Speaker. Well, I'm very glad that we've had a chance for at least a few members of the House to debate this issue today. I really did regret the scene that went on before we got around to having the debate with the points of order and the delays that engendered. Now, I believe that we need a public inquiry, Mr. Speaker. We clearly need something that is independent as possible from the government. The Public Inquiries Act, in my view, is the right tool to use, and hopefully that the government would see fit to appoint a federal judge or retired judge in order to oversee this. Now, there's been a lot of talk about whether there's proof or not, and the government is setting a very high standard of proof before they're even willing to consider this. And, Mr. Speaker, I submit that what we need is not proof, absolute proof, to have an inquiry, because if we had it, we wouldn't need the inquiry. But what we do need is evidence, and that is what the government has been calling on. The government has been calling for evidence to back up the claims from the honourable member of Edmonton Meadowlark, and that evidence is starting to flow. And quite frankly, I think if the government doesn't seize this opportunity to have an inquiry, the evidence will flow in a way that they'll find very, very difficult a little bit down the road. So we have evidence. Now, the Honourable Justice Ministers talked about the need for criminal charges to come forward to the police if there is criminal acts. But many of the things that we're talking about, Mr. Speaker, are simply acts of intimidation and job-related actions, professional-related actions that are not crimes. But they are entirely inappropriate and they need to be investigated. So, for example, when a physician is threatened with the loss of their license, that is not a crime, but it's something that the public needs to know about and we need to know about, and something that this government doesn't want us to know about. I want to take the instance of Edmonton Meadowlark, because we all know some of the facts around there, and I know that the minister has made a big stink about any mention of the Alberta Medical Association or the Council of Physicians and Surgeons as being bodies, not that are accused of anything, but their role to be investigated as part of the terms of reference that the opposition parties put forward. And it should be. We saw, for example, the honourable member for Edmonton Meadowlark, when he was in debate, at the behest of the honourable member for Edmonton Rutherford, the president of the Alberta Medical Association phoned a number of colleagues of Edmonton Meadowlarks and said that there were some issues around his mental illness, and there has been suggestions made, and I think they've been substantiated, that specific types of mental illness were attributed to the honourable member. Now, then within a day or two, the College of Physicians and Surgeons sent a psychiatrist to the honourable member's office in order to perform a psychiatric assessment on him. That's the Alberta Medical Association and the College of Physicians and Surgeons, based on a call from a politician on the government side, which was under a great deal of pressure at the time. And, Mr. Speaker, here I very much regret not being able to come forward with my point of privilege, because those actions by those two bodies or officers of those bodies were taken not based on Edmonton Meadowlark's performance in his job as a doctor, but based on his behaviour in this chamber. And I think those officers and those organizations should have been brought before the bar of this assembly and made to account for their attempts to interfere with the honourable member of Edmonton Meadowlark. Now, we now have a statement of claim by Dr. McNamee, and his experience, as recounted in his statement in a legal document, is eerily similar to that of Edmonton Meadowlark. Faced with the loss of license, he was speaking up on his patients, and they were prepared to take away his license. There was allegations made about his mental state, and so on, and he eventually had to sign an agreement, a confidentiality agreement, which prevented him from speaking about this, and I don't know, I would assume, in exchange for financial compensation. That's normally how it's done. And he left the province. Then we have Dr. Maybaum. Dr. Maybaum is the president of the Calgary Area Physicians Association, and he said that he received a warning letter in 2008 when he spoke out about this government's postponement of a new psychiatric wing in the South Calgary Hospital. He has said just this weekend, we need this judicial inquiry desperately. This is our chance to make a change in the system. Now, Mr. Speaker, also a former member of the Calgary Health Authority by the name of Mary Matheson has said, and I quote, that an inquiry would reveal, quote, some shocking numbers. There has been untimely deaths in large numbers as an outcome of the closure of acute care beds. So, Mr. Speaker, people are starting to speak up. Now, is this proof? Of course it's not proof. And we do not require proof in order to have a public inquiry. What we need is evidence, and we need professional people who have been involved in the system and experienced this to come forward in increasing numbers to substantiate the experience and the allegations of the honourable member for Edmonton Meadowlark. Paul Parks, another doctor, says that the health system is becoming toxic. Now, and there's many others, and a lot of people will come forward, and I think this is what the government fears. So I want to say that I've wondered for some time now why we can't seem to fix the healthcare system. Certainly the government throws money at it. I will give them that. They certainly put money into the healthcare system, although 2 years ago they wanted to cut $1 billion out of it. But now they're putting some money. But we can't fix it. And why? Well, I think this is one of the reasons, Mr. Speaker, that we can't fix it, and that is because we've got a culture of intimidation in the healthcare system, and people who have problems, see problems for their patients, see people dying unnecessarily, are afraid to come forward. And that is why this public inquiry is so essential. We need to change the culture in the healthcare system, which has come down from the government and infected the whole system, in my view, in order to make sure that people can speak up and carry out their Hippocratic duty to speak and put their patients' welfare first. So, Mr. Speaker, I want to deal just briefly, while I can, with the whole question of why a judicial inquiry, or why a public inquiry with a judge, is appropriate, and what the government has proposed is not. Now, the Health Quality Council, as we've said, is not a bad organization, but its mandate is to look at health quality issues. And so I think it's quite appropriate for this body to deal with, for example, some of the problems with waiting times in emergency rooms. Perhaps it could deal with the relationship of the government's backward policy on long-term care, on waiting times. It can look at cancer waiting times. It can go back. It can examine many of these functions. But in terms of the policies of the government and potentially some other organizations in the health system acting as agents for the government in order to create this culture, it's not competent. It's not within its terms of reference, and it's not competent to do that. The minister has tried to assure us that they'll be allowed to set their own terms of reference. But I think we need to be clear what the terms of reference are, and I think that it's very important that those things include whether healthcare professionals were subject to intimidation, including retribution, professional or employment discipline, or the threat thereof, or attacks on their character and professional reputations in order to prevent them from speaking about issues which affect patient care and the effective delivery of health care. Now, the other thing here, Mr. Speaker, is that the medical establishment in our province is relatively small. It's a small world, and so you find, for example, that Dr. John Cowell, who's the CEO of the Health Quality Council, is a member of the same consulting firm as Dr. Bob Baer, the same guy that fired Dr. McNamee. So it's a pretty tight little group, and I'm not saying that there's any problem with that relationship whatsoever, but it does say that we need a degree of separation. We need to get outside the medical establishment and have a truly independent look at it from outside. And finally, Mr. Speaker, the last reason is the Health Quality Council cannot subpoena witnesses. If someone doesn't want to voluntarily come to answer questions, they don't have to. And they can't subpoena evidence, so it can't, and they can't protect people, so they can't get to the bottom of it. They won't be able to get to the bottom of it, which is exactly what the government wants. They don't want to get to the bottom of this, Mr. Speaker, and that's the bottom line.
The Honourable Minister of Finance.